So I'm going to pick up from where we left off the other day, and with the pathology terms and the combining forms are really important, and I wanted to be able to spend time on it. We don't have enough time in class for me to do the whole PowerPoint, so I'm going to try to do this for the rest of the course. So for the first combining form, if you see on this slide, vessel, the combining forms that they're going to be using are angi and vas. They both mean vessel. So you have to look at how it's being used. So angio, like angioedema. She had angioedema in her face and arms, and that's fluid that's up underneath the skin, and it's subcutaneous, and it can be caused from a chronic disease, or it can be caused from a congenital disease, and it's really, it's really sad to see, because it gets swollen and puffy, and you can push into it and leave fingerprints. It's like pitting edema. So the next word is the meaning heart. So we've come across cardi and coron. So coronary, okay? She had a coronary the other day. I used cardio as cardiomyopathy is an enlarged heart. So this is how I want y'all to start looking at this, and you'll see how they're used different, but they mean heart, the same meaning, okay? Blood, hemo or hematocrit. That's a blood test that you have when you have a complete blood count usually. It's a hemoglobin and hematocrit. So his hematocrit was very low, and that was the reason for his weakness, because you don't have the oxygen in your blood, so you get weak, you get short of breath when you try to walk. The other one, hemostat, okay, that is not a really good example, but hemothrombosis. Okay, a blood clot. So that, you see how that was two root words. Vein, phlebitis. Phlebitis is an inflammation of the vein, and you can get it if you have an IV. You can get it from any sort of injury to the vein, like if something hits your arm or your leg, you can get a phlebitis. The other one is ven for vein, V-E-N-O, veno, okay, veno. So look at how they're using these in the sentence and what they're asking for. Valve, valvo, she suffered with aortic valvular disease, it was congenital. Why is congenital? It was from birth, okay? So valvulectomy is a removal of a valve. Valvular can be used in a disease. Artery, arteriostenosis is a chronic disease. So what is that? The artery is hard, okay? It's stenosis, it's narrowed, it's got plaque in it. Thick, fatty, atherosclerosis he had atherosclerosis, that is what caused his TIA. What was TIA? That's the trans-ischemic accident. So that's like a stroke, but it's not, it goes away. Pertaining to atria and ventricles, atrio. So I used the atrioventricular valve. Okay, so we had that in this chapter, and that's the valve between the atrium and it's the valve between the right atrium and the right ventricle. And it was very weak and causing regurgitation. What is regurgitation? Regurgitation is the backflow of blood. So that valve is a one-way valve. but it wasn't closing back. So when the ventricles contracted, the blood came back up into the atrium, which is not a good thing. We've got abbreviations. Now, this is where it's going to get a little tricky. Okay, so let's look at it. I gave some examples. AFib, and the other initial abbreviation is AF. Atrial fibrillation, that's where the atrium is quivering. And we use that in CPR, and they always use the example of, think of when you catch a fish and the fish is quivering when you've got it out on the sidewalk or the boat or whatever, it's quivering, okay? So it quivers, and that's what the heart is doing, the atrium. That's what the atrium is quivering. It's not contracting and relaxing like it's supposed to be. ASHD, arteriosclerotic heart disease. That's a chronic disease. Heart disease, okay? So just remember that. It's a lot easier to say the ASHD. AV, and look at how it's used, A-V or AV. And that's the atrioventricular, and that there's a node, that AV node, okay? That's what's going to take over sometimes when the SA node can't make your heart beat. So then the AV node kicks in. We know what BP is, and you see how they've used it, BP or B/P, blood pressure. And you've got the systole and the diastole, okay? So the systole is the contraction, and the diastole is the relaxing of the artery. CABG, CABG, and that is an abbreviation for coronary artery bypass graft. This is a surgery. It's really become really common now, and it has saved so many lives. And this is a surgical creation of altering the route of blood flow. So they take a vein from the leg, and they put it up in the heart. And to do this, now in some hospitals, and I think they're teaching hospitals, they've been able to do more of this with laparoscopically, but they usually go in the chest. They take a saw and saw through the sternum, and then they spread it, and they open up the heart that way and look at the heart, and they're able to replace the valves. The CAD, coronary artery disease. It is a chronic disease, and it usually is narrowing of a lumen of a vessel due to arteriosclerosis and atherosclerosis. Now remember, atherosclerosis is the fatty substance that's in the blood. So that is, they also call it plaque, and it's also cholesterol. CCU, that's the unit in the hospital where you go when you've had heart surgery, after you've had heart surgery or any sort of heart event. CHF, coronary heart failure, or heart failure, which is HF. So it can go CHF or HF. So most people say CHF. And congestive heart failure, and the symptoms are they're short of breath. And the reason why they're short of breath is because they're accumulating fluid in the lungs. They're literally drowning in their lungs. CP, chest pain. Okay, so just use that CP, chest pain. CPR, cardiopulmonary resuscitation. And look at that. It's got the a combination form there. Cardiopulmonary resuscitation. Okay. CV, cardiovascular. DVT, deep vein thrombosis. This is a blood clot, and it's usually in the legs. And we read about how travelers sitting for long periods of time, they get a DVT, and it's deep vein thrombosis. Now here's where you can go either way, ECG or EKG, electrocardiogram. That's the recording of your heart. Echo is the ultrasound. It gives the ejection fraction of the heart. It shows how the heart is really pumping and how much it pumps out. The INR, that's a procedure. It's International Normalized Ratio, and this is a procedure showing prothrombin time, which is also called PT time. It's called PT, and it's used with patients taking Coumadin, and the generic name for Coumadin is warfarin. We're not really working with pharmaceuticals because I think that's just a little too advanced. So, but you will pick up on it. This is a common drug. A lot of people are on Coumadin or warfarin, and they have to have blood tests done every month. ICU, intensive care unit. Now, this is where anybody that's really serious other than heart events, and sometimes the heart events will flow over into ICU if the CCU is full. But ICU is where you have people that are really, really sick. They have ventilators because they don't allow ventilators on the floor, like in a med-surg floor. They have to be in the unit because you have to really be one-on-one with them. Sometimes one-on-two. One nurse with two patients, and that's all they can have. Whereas on the floor, in the hospital med-surg floor, the nurse will probably have 6 or 7 patients. HR, heart rate. And our heart rates, the regular heart rhythm heart rate should be about between 70 and 100, or 60 and 100. And that makes it, that's about the normal heart rate. Anything below that is a bradycardia, slow heart rate. Anything above 100 is tachycardia, fast heart rate. INR, PT, PTT, these all show how thick the blood is or how thin the blood is. So that you will see that with the Coumadin. You will also see it with heparin in the hospital. They don't use heparin outside the hospital. RA is for the right atrium, so that is the upper chamber of the heart on the right side. The right ventricle is the lower chamber on the right side. And then you've got the left atrium and left ventricle. MI is another fancy word for a heart attack, okay? So they say myocardial infarction. So look at that combining form. Myo is the muscle. Cardi is the heart, okay? So it's the heart muscle. It's death to that heart muscle. It's not the whole heart muscle. It could be a portion of it because they can see how much damage there has been to the heart. MVP, mitral valve prolapse. The mitral valve is, the other name for it is bicuspid valve. It's on the left side of the heart between the left atrium and the left ventricle. A lot of women have a mitral valve prolapse, and these are a bicuspid valve. So it's 2 flaps in it, and it's one-way valve, and so it pumps it in. And sometimes it's floppy, that means prolapse, and the blood comes back up into the left atrium. P, use your P for pulse, temperature, pulse, respirations, okay? So TPR. PAC is premature atrial contraction. That's where the atrium is contracting sooner than it should. So that throws the whole cycle off, and what it can do is blood stays up in that atrium and sits, and it could cause a blood clot. And when people have PACs, which is also part of AFib, AFIB, that they have to take aspirin or some sort of blood thinner. A PVC is the premature ventricular contraction, and that's where the ventricle is contracting out of sync, okay? So you can't have it. It just gets everything out of sync, so blood pools, and it has a tendency to cause clots. PTCA, percutaneous transluminal coronary angioplasty. That's a cardiac cath. Okay, so you see why they use so many abbreviations in this area of the med terminology. So that's where they go into the groin and they take it's a wire catheter, and it goes up into the groin, up through the aorta, up into the heart, and then they inject dye up there, and they can see how any veins, arteries, anything clogged up there, how the heart's contracting, and it gives a nice picture of it. And they do go in the groin. Now they're going into the wrist. So the radial artery, they go into there, and then the patient doesn't have to stay down for a period of time, and they're usually discharged a lot quicker. VFib, that's ventricular fibrillation, and this is the bad one. And the heart is quivering, and it can cause sudden death. VTAC is ventricular tachycardia, and this is a heartbeat that's greater than 100 beats a minute. So the ventricles are contracting a lot faster. So it's really out of sync, and it can cause a lot of issues, and it doesn't feel too good. Now let's get into some pathology terms. Arteriosclerosis. Now we've gone over some of this, so you should be a little familiar with them, but I'm going to be going through these pathology terms because I really want y'all to understand, and hopefully we'll be able to see some of it in some videos, or even hear it on ourselves, maybe. I don't know. Arteriosclerosis. Vessels become narrowed and hardened. So, and this is caused by hypertension. Hypertension causes so many issues with your body, and it causes this. In the worst case scenario, it causes a stroke, and it can also cause you to have kidney failure. And people have to go on dialysis when it gets really bad. Atherosclerosis is cholesterol buildup in the vessels, causing further narrowing and blockage. So that's when people have to go on a low-fat diet, and they have to watch what they eat, and they have to exercise, and they usually have to take medication if the diet's not working. But a lot of times, if they just watch what they eat and stay on that diet and exercise, it clears up. Aneurysm is a weakening and bulging of a part of a vessel wall. So the most common ones are brain and abdominal. So down in the abdomen, you've got the aorta, that it comes out of your heart, and this is the main pipe. And so it comes out of your heart, and it goes down in your stomach. And when you're laying flat, you can feel right above your belly button, you can feel that pulsating. That's your aorta. That's the abdominal aorta. Now up in your heart, it comes out at the aorta and forks out to go up to the brain. It's your carotids. Okay, your carotid arteries are the ones that come out of the aorta. So you can have a brain aneurysm, or you can have, abdominal aneurysm. And now like the abdominal one, if they are assessing it and checking it like every year or whatever. If a patient has a bit of a bulging and when it starts growing to a certain size, they're now able to do like a cardiac cath on it. They go up in the femoral artery, and they're able to clip it, and the patient doesn't bleed to death and doesn't die. It's amazing. A bruit. This is a soft blowing sound caused by turbulent flow in the carotid. So when this is when we can hear, put a stethoscope up to your carotids up in the side here, and you can hear the cardiomyopathy. Heart muscle has deteriorated. Okay. So this is and I think I used it in the wrong way previously, but cardiomyopathy, heart muscle has deteriorated. So it does. The muscle just it gets weaker, and it's a lot of times, if the person's young enough, they can do a heart transplant. Congestive heart failure, CHF. This is the inability of the heart to pump enough blood to meet the needs of the body. And this results in lung congestion and dyspnea. Dyspnea is short of breath. So this is this is where they do the echo, and they can get a measurement called the EF%. And if it's like above 40, it's usually okay. But if it's below 40, it's not good. That means that the heart's not pumping like it should. Cor pulmonale, condition of the right ventricle enlargement or dilatation from increased right ventricle pressure. This is also called pulmonary heart disease or right-sided failure. And it's really sad. That right ventricle gets larger and larger. Embolus. Okay, so now think of embolus. Okay, it's undissolved matter floating in blood or lymph fluid that may cause an occlusion or an infarction. Infarction is some sort of event that's going to, an embolus, when they're doing certain procedures, they have a procedure where they do, it's called a carotidectomy. And they're cleaning out the carotids because it's got plaque in it. But one of the side effects is that sometimes a little bit of plaque will break off and float up to the brain, and it causes a stroke. And I've had patients that came out to the recovery room after they had the procedure, and they had a stroke. And that's sad. Endocarditis, infection of the inner lining of the heart. We have to be careful. Some people with valvular disease, or they also with artificial joints in their body, they have to have antibiotics when they go to the dentist for cleaning. When they have their teeth cleaned every 6 months, they have to have antibiotics prior to that, because there's a tendency that you could get an infection from the mouth, and it goes right to the heart, and it causes endocarditis, and it could cause death. The bad part of it. I have to have medication before I go to the dentist every time. So, I don't want to have endocarditis. Ischemia, temporary reduction in blood supply to a localized area of tissue. So that could be caused by, if you have some sort like a compression trauma, and so it could cause ischemia. If you don't have enough blood going to a part of the heart when you've had an MI, it can cause ischemia. And ischemia can go into necrosis. Mitral valve regurgitation, I mentioned that earlier. That's where that bicuspid valve is floppy, and when the ventricles contract, the blood comes back up through there, and it's not supposed to do that. And if it gets really bad, they have to do surgery, a valve replacement. Mitral stenosis, condition in which the mitral valve fails to open properly, thereby impeding normal blood flow and increasing pressure with the left atrium and lungs. So that's another, another part of that bicuspid valve. It could be a stenosis. A murmur, it sounds like a bruit. It's a blowing or a swishing around the heart. So when you have a mitral valve prolapse, sometimes you can hear that blowing or the swishing sound. I want to go back and I was thinking when we were at the cardio part of the terms, the combining forms, I was thinking of cardiomegaly, the large heart. So I'm sorry I got you confused there, but I just wanted to kind of go back and correct myself on that. Bradycardia, slow heart rate. It's less than 60 beats per minute. Now see that abbreviation BPM? That's what we use, BPM, okay? So Brady is slow heart. Deep vein thrombosis, we just had that, the DVT, the development of a blood clot in a deep vein, usually in the legs, known as thrombophlebitis. Now see, you've got throm, that's the blood clot, phleb, that's the vein, remember? And itis. So that's how I want y'all to be looking at that. And you can say, oh, I know what that is. Myocarditis, middle layer of the heart wall becomes inflamed. Pericarditis, acute or chronic condition in which the fibrous membrane surrounding the heart becomes inflamed. So remember Peri was around. It was around something. So card and itis. PAD, peripheral artery disease. This is partial or complete obstruction of the arteries of the arms or legs, and it is similar to PVD. Both are bad, and people have lost limbs over it. Polycythemia vera. This is a chronic disorder marked by increased number and mass of all bone marrow cells, especially RBCs. What are RBCs? Red blood cells. With increased blood viscosity. What is viscosity? That is thickening. The blood gets thicker, and a tendency to develop blood clots. So this is pretty serious too. Raynaud's disease affects blood vessels in the fingers, toes, ears, and nose, triggered by cold temperature. So people have this, and when it starts getting cold, they have to wear gloves on their hands, and they have to protect their noses. They have to protect their face. Rheumatic fever disease. I haven't heard too much of this lately. Years ago, back in probably about the 50s, children got rheumatic fever. And it causes heart issues, big heart issues, in which inflammation and damage occur to parts of the heart, usually the valves. Children died from this, and or they developed heart disease from it, and they were weak, and some of them, it caused them to die later, or they were very weak. I had a friend of mine that she had it when she was little. And even when we were teenagers, she was very thin and very small. Shock. That is inadequate perfusion as a result of hypotension or low blood pressure. Shock happens during an accident, any sort of trauma to your body. And your body is trying to compensate, and sometimes it can't, and you can die from shock. TAO, thromboangiolitis obliterans. I've got to tell you, I do not know this. Type of vascular disease associated with tobacco use, marked by inflammation and clot formation within small vessels of the hands and feet. Well, another reason not to smoke. Now we're going to go over some diagnostic tests and procedures. Angiography, diagnostic or therapeutic radiography, which is usually x-rays of the heart and blood vessels, okay? So look at that, angie, okay? So that's heart and blood vessels. AICD, that's the automatic implanted cardioverter defibrillator. And this is, I've got a picture of it. See it in the man's chest to his right upper, up around, it's the right upper chest. And you can see what they do, they make a little incision just below the clavicle. And it makes a pocket. They make a little pocket and they put it in there. And they put the leads. The leads come down out of this. They're wire leads, and they come out and they go into the heart. And they float it into the heart. Now, if you look at this chest picture here, see in the middle, you've got the sternum. See that little bulge there going to the left of the heart? That's the aorta. So, and then on down, you can see the silhouette of the heart coming out to the left here. So, and then you can see the ribs, but on the right side, just below the lungs there, that's where your liver is. Cardiac catheterization, evaluation of the heart vessels and valves via the injection of dye that shows up under radiology. And they can see it, and it's really cool to watch that when they do the dye, you can see it going in and going all through the heart. Cardioversion, restoration of normal sinus rhythm, NSR. That is the steady beat of your heart. If it's an irregular beat, is it arrhythmia or dysrhythmia? But the cardioversion can be done by chemical or electrical means. I had to have a cardioversion, chemical, thank God. My heart, it was several years ago. My heart got up over 200 beats a minute, so BPM. And so I had to call 911 on myself. And let me tell you how weird that was. So anyway, paramedics came, they said, oh yeah, we got to get you to the hospital. So they got me to the emergency room, and they roll in the code cart into the emergency room on me. It really scared me because I knew what was going on. And so the ER doctor said, okay, what we're going to do is we're going to use this medication and see if we can convert you chemically. Thank God they did. It only took 2 times. So my heart slowed down and got into a steady rhythm. CABG, CABG, we talked about that earlier, coronary artery bypass graft. It's a surgical creation of an alternate route for blood flow around an area of coronary arterial obstruction. So, like I said, they find a good part of the vein in the leg, and they take a piece of it and they put it up in the heart and transplant it. Basically, is what they're doing, and it's really amazing. Defibrillation, delivery of an electric shock with the goal of ending ventricular fibrillation and restoring NSR. So they want to, when the ventricle is quivering like this and it's fibrillating, the VF, remember that's abbreviation, they put the paddles to it and shock it, and hopefully it goes back into normal sinus rhythm. INR, standardized method of checking the PT, prothrombin time. used to monitor and adjust warfarin Coumadin dosage in order to maintain a balance between clot prevention and excessive bleeding. Pacemaker, device that can trigger the mechanical contractions of the heart by emitting periodic electrical discharges, used to prevent bradycardia and other arrhythmias. So the AICD that we just saw, the pacemaker looks like this too, and they do have a combination of a pacemaker AICD. So if the pacemaker, if your heartbeat drops, like usually when it drops around to the 40s, they don't like that. So they put a pacemaker in you. So when your heart drops down, that pacemaker kicks in and puts it back up where it should be. And they usually have it set in the 70s. The percutaneous transluminal coronary angioplasty treats narrowing coronary artery via inflation and deflation of a balloon on a catheter going through the right femoral artery. So that's what they're doing. They can go up through there, or now they're going into the radial artery. They put this catheter in there, then they slide up a balloon, and then they inflate the balloon, and it breaks up that plaque. It's really cool. Transesophageal echocardiography, TEE. This is like it's like an EGD. They do it at bedside usually, and it goes down, and they put it down into the trachea, down into the lungs, so they can see if there's any blood clots down in the heart, around in the lungs, and it's a good way of doing it. Electrocardiography, ECG, EKG, we all know that is a record of your heart. Now this, I want y'all to watch this video. It's really cool. And I think that it will show you how everything works with the heart. And so I want you to watch this, okay?